Hello, my name is Selena, and I'm here to talk about ADD and ADHD with the contribution of my team partner, Japriya. So ADD and ADHD is attention deficit and hyperactivity disorder. You will see when you look at our slides, Japriya has made a wonderful video explaining a lot more in detail about what that is. So in our introduction, we have that ADD, ADHD can look like a persistent pattern of inattention and or hyperactivity, impulsivity that interferes with functioning or development. And there currently is no biological marker. We can't do a genetic test or a blood test to diagnose someone with ADHD. It's purely observational and through anecdotal sharing and working with the client or the patient. So currently it is being treated with stimulants and psychotropic medication, supportive psychotherapy, as well as, or alternatively, behavioral interventions. Symptoms can include, and this is a very short list of a very long list, difficulty starting tasks, lacking attention to detail, difficulty with organization, low frustration tolerance, hyperactivity, lack of follow-through, and chaotic lifestyle. And again, I cannot stress this is just a few potential symptoms. As a practitioner, if you're looking at someone with the consideration of diagnosing, this is, I will mention, something that starts in youth, unless there is a case of head trauma or brain injury. In most cases, this is something that starts in childhood and progresses into adulthood, although often many adults have gone undiagnosed through their childhood. So diagnosing at a glance again, the DSM defines ADHD, ADD as the essential feature is a persistent pattern of inattention and or hyperactivity, impulsivity that interferes with functioning or development. Now, alternatively, Francis, the text that we've been reading, would caution before making the diagnosis, ensure that the symptoms go back to early childhood, are not just associated features of another psychiatric disorder and are so severe as to warrant being considered a mental disorder. Being distracted, being unable to focus may just be a result of not having enough sleep, being overcaffeinated, being overstimulated, etc. So as a practitioner, ask thorough questions before reaching a diagnosis. So be very careful that your client isn't experiencing oppositional defiant disorder, conduct disorder, adjustment disorder, intermittent explosive disorder, or malingering, which is something that is seen very common with this particular ailment, especially since there is no biological test. So attached, we have a wonderful video from the adult ADD study community where an adult does go in and take the test, and they give you a wonderful view into what an ADD, ADHD test experience looks like. It's a great video, 7.5 minutes. Please take the time to watch it. It's very informative. For further information, for the resources, check out the ADHDadulthood.com, add.org, and if you are someone looking for help, looking for a coach, the #1 coaching program for folks with ADHD looking for behavioral redirection therapy is the expertadhdcoaching.com. Rave reviews. Here are our resources, and thank you so much for your time. I hope this was informative.